Now more than ever, science matters. It's imperative to the future safety of the world. We need science to help take care of our personal health. And 2020 has taught us that we need researchers and healthcare workers with a passion for science so we can solve a public health crisis and face any challenges that life throws our way. Now, all season long, you're going to meet people interfacing with science and health, and here's some of the incredible work that they're doing. That's why I have teamed up with my trusted sponsorship partner, Olay. And together, we are hitting the road for our Face Anything with Science tour. The first stop of the tour, nurses on the front lines. Here are some of their stories. I'm hitting the road with Olay for our Face Anything Science tour. And what better place to start than with the selfless, brave, and devoted nurses of RWJBarnabas Hospitals in New Jersey. Like so many others, they've recently gone through some of the darkest days of their careers.
When coronavirus hit, it was very overwhelming. For 3 months, my life was just work and sleep.
Everyone was very fearful. Shifts were very long, and we were running on full adrenaline.
I felt like I was in a military hospital.
This was a war, except we couldn't see our opponent.
It's been the most death that I've ever seen in the hospital.
It was very rough, especially if you grow attached to these patients.
It's not just numbers and calculations and medications. It's someone's mother, someone's husband.
I didn't think it'd be this emotional talking about it again, but it was very emotional.
Since families couldn't come to the hospitals, we became the support.
There were times where we would just garb up and sit with someone because we knew they weren't going to be here tomorrow.
I was scared, but I put my fear aside. I wanted them to know that I'm in this with them.
The emotional toll was just, sleepless nights, anxiety.
I actually caught COVID myself, and I had full-blown left-sided pneumonia. I think the worst part about it, by far, was just being by myself.
I went through the same thing. The patients were going through the shortness of breath.
So the hardest part for me was sending my daughter to my in-laws' house. It happened during a time when it was her 5th birthday, and I couldn't be there for her.
During COVID, there was not really much time for self-care.
The last thing you want to do is think about yourself.
The PPE takes a toll on your skin. I could feel my face so dry at the end of the day.
This has been really tough, but there have been some heartwarming moments.
When patients were discharged, we would line up the hallways, and everyone would clap.
And as tough as the pandemic was, it showed me that this is what I want to do. I want to make a difference.
Nursing is love in action.
It's an honor and a privilege to be able to, do the jobs that we do.
I'm proud to be a nurse.
That's powerful. Nurses all across America have been through so much these past few months and are so often the unsung heroes. To help you all face anything, I'm joined by dermatologist Dr. Michelle Henry and by Olay principal scientist Dr. Franco Noza via Zoom. Dr. Henry, we just heard of the challenges these nurses are facing emotionally. Why right now is it particularly a trying time for their skin?
Well, right now, our health and safety is our top priority. And unfortunately, our skin is paying the price. So whether you're a nurse in full PPE or you're at home in dry air, all of my patients are telling me that their skin has never been more vulnerable. And this is because we're experiencing more friction. And this can lead to a disrupted skin barrier. It can lead to inflammation. It can lead to irritation. Trapped oil, dirt, debris can cause acne. So if we really want to have superior skin, what we need to do is have a deep understanding of skin science and combine that with women's changing needs.
Dr. Noza, as a scientist yourself, why is it so important to take care of your skin? Why now more than ever before?
Skincare routine has never been more important. Good hydration and a strong skin barrier are important for skin's health and appearance at the best of times. But research has shown that stress can actually weaken your skin's moisture barrier function, making it more prone to dryness and dullness. So we have to protect and strengthen our skin's moisture barrier, which is why applying the right moisturizers with targeted ingredients that have been studied and tested is so important. Ingredients like vitamin B3, aminopeptides, and hyaluronic acid all work to hydrate and improve skin's moisture barrier so skin can better hold on to hydration.
So, Dr. Noza, you actually brought as a demonstration to show the importance of a strong skin barrier. And I want to show this to everybody. Take it away. Explain what we're looking at.
All right, so these balloons in this demonstration will represent your skin. So first off, this balloon represents your stressed skin, skin that isn't properly hydrated and that has a weakened skin barrier. And then we have a flame, and the flame represents the environmental stressors that your skin will come in contact with, metaphorically speaking. And so what we're going to see is that when skin is it doesn't have the resilience and protection it needs, it is more vulnerable.
All right, so I'm going to demonstrate this. So I've got the environmental stressor represented by this flame. The skin barrier, I can sort of feel is dry. If I bring them together, what happens is pretty... Oh, it popped. If you can look on the inside, you can see it's dried and desiccated out. So I appreciate that you don't have much of a protection from a basic environmental stress, because it can come from every which way, especially if you're, for example, a nurse taking care of a sick patient. Okay, now you've got a second balloon here. What does this represent?
Right, so now imagine this balloon is your skin. When it's treated properly, it can actually hold on to the hydration it needs. It is, you know, as you can see, it is actually plump, it is bouncy, but also importantly, it is strong and resilient.
All right, so now I've got, since I saw what happened to the last balloon, I have this container here. Do I need the container? Is this going to pop or not?
No, it's not going to pop.
Now I can feel the moisture in this balloon, obviously, because it's full of water. The skin barrier is intact. It's moist, representing what you just said. I've got the same kind of irritating material, environmental stressors, and I'm holding the flame the same distance, even closer. Oh, my goodness, you're right. It doesn't pop. Dr. Henry, are you impressed, Dr. Henry?
I'm wildly impressed.
Very nicely done. All right, so what do you recommend? If you want your skin to be like this, what do you recommend to help the skin's moisture barrier?
So I like the Olay Regenerist microsculpting cream. It's infused with vitamin B3, aminopeptides, hyaluronic acid, and antioxidants. Its moisture binding formula instantly hydrates to improve elasticity and firmness, and it also helps to diminish the appearance of fine lines and wrinkles.
Yeah, I want to keep my skin plump like this balloon.
Yes.
Does it feel like that, Dr. Henry?
Amazing, exactly like that.
As a dermatologist, what ingredients do you find most critical?
So I love products with retinol. So retinoids are really important to dermatologists. They're really the gold standard for creating brighter, smoother skin. And that's why I really love the Olay Retinol 24 Facial Moisturizer. So, you know, it's a really gentle formulation. So it also hydrates the skin, which is really important right now. But we also get all of the results that we get with the traditional retinoids. So visible reduction in fine lines, wrinkles, and dark spots.
Well, beautifully described. Where do you find these products, Dr. Noiser?
At retailers nationwide and at Olay.com.
So I know a lot of deserving nurses whose skin could use some of this TLC. So take a look at what happened when we surprised the nurses that you just met earlier from RWJBarnabas Health hospitals in New Jersey. Socially distanced, of course. Here we go. As a way of offering a well-deserved thanks, and with social distancing and skin protection in mind, we set up a Red Jar bar just outside the hospital. With the help of board-certified dermatologist Dr. Michelle Henry,
Do it.
it was time for our caregivers to experience some well-deserved self-care. I'm so happy you're all here. I only got one question. Are you willing to let yourself get pampered?
Yeah.
This is your Red Jar bar. I hope you enjoy it. Dr. Henry, what do you got here?
So we have products targeted to cleanse, treat, and moisturize your skin. We're going to help each and every one of you develop your perfect skincare routine.
All right, so I took my mask off because I'm going to stay 6 feet away. Dr. Henry did the same thing. You can take your masks off as well. I only ask one thing. Have a good time.
This one was really nice.
Wearing the mask, I get a lot of dryness.
Is anyone else suffering with this?
Yes, I do too.
Friction between the mask and your skin is causing you to release water from the upper layers of your skin. So what I love to do for that is to really apply your moisturizer throughout the day. And I really love the Olay Microsculpting Cream. But for the sake of safety, I'm going to let you try it yourself and let me know what you feel.
And by the way, we're 6 feet away, but we also just got tested. Isn't it good to be pampered once in a while?
Yes.
How's it feel?
It feels great. It's very rich, but it doesn't feel sticky and it doesn't feel heavy on my face.
I noticed my face being very dehydrated and fine lines. I've noticed them more.
What I really love for that is the Olay Retinol 24 Facial Moisturizer. And so what's really great about this is that it hydrates and renews the surface of the skin. Feels great. Good. Now, if wrinkles are your major concern, then I have something for you. This is the perfect place for a serum.
I know nurses love to learn, so I'm glad we showed you some products, but you didn't come here to try them. You actually came here to get them. So I'm giving you all bags to fill up with all the Olay products you want. A lot of things have changed with the pandemic, but one thing that hadn't changed is you cannot take care of other people if you don't take care of yourself. So self-care is not selfish in my book. So I want you to look great and feel great so you can face anything that comes in your path and you can keep saving lives. You all in? Yeah! It is always rewarding to give back to nurses and healthcare workers, and giving back is nothing new to Olay. Olay has been stepping up to help essential workers all summer long, including donating $10,000 worth of products to my own hospital. We'll be right back.